So one question show from here. Till now I told you the 3 points. हे भगवान, ये मैंने क्या देख लिया, अच्छा हुआ जो मैं अंधा हूं. Okay, yes. So what I told you, three magics. One question sure from the intermuscular space, any boundaries. One question sure from your any joint and their movement, and one question sure from the nerve supply. Done, beta? Okay. Okay, so now general anatomy, one question especially joint. So get ready for this one, sir. Four parts of the young bone. Do you remember? Epiphysis, diaphysis. Yes, the epiphyseal end of the diaphysis, metaphysis, and the cartilage in between. Sir, this is the growth plate of the cartilage. Okay, four parts. One, two, three, four. Question. This is the PYQ. Which type of the joint is found at in between the epiphysis and the diaphysis? Primary cartilaginous. It is also known as a synchondrosis. It is also known as a synchondrosis. Agree? Okay, sir. Now catch this one. After few time, when the growth hormone effects is gone, after the ossification, only the epiphysis and the diaphysis. So only two parts of the adult bone, na? Two epiphysis and one diaphysis. No metaphysis, no growth plate cartilage. Yes, MCQ. This growth plate cartilage, which kind of the cartilage? Hyaline cartilage. Yes, it is hyaline cartilage. Getting the point? Okay. Yes, growth plate कब disappear होती है? When there is the fusion between the bones, and every bone is having the different fusion time. You will learn in the forensic medicine age estimation unit. Okay. Now there is a hairpin band. Artery is coming and it is making the hairpin band at the metaphysis. So MCQ. Most common site for the osteomyelitis. Answer is the metaphysis. This osteomyelitis is found in children or adult because metaphysis is found in the children. That's why it is found in the children. Getting the point, everybody? Okay, sir. So which bacterial infection is common? Because it is coming from the surface of the our skin. So Staphylococcus aureus. So this is the microbiology, orthopedics, anatomy, beautiful integration. Very good answer, Raj, Chirag, Pikachu. You all are right. Okay, so these are the things which we had seen, the parts of the bone. Again, I'm revising the three integration. Sure short one question from the bone parts, either from the anatomy or from the radiology or from the orthopedics or from the microbiology. Most common site of the bone infection, metaphysis. Most common site, most common cause, Staphylococcus aureus. Most common age group, children. Why? Due to the hairpin band arrangement. Okay. Also, I told you about the question types of the epiphysis. One question asked in the January 2025. Yes, patta, PTAA, four type. P for pressure epiphysis, T for traction epiphysis, A for aberrant epiphysis, A for atavistic epiphysis. Yes. So, what are the pressure epiphysis? Long bones. Their ends are classical example of the pressure epiphysis. Traction epiphysis. Whenever there is the forcefully pulling, and there's a development of the trochanter, there's a development of the tubercle, then it is a traction epiphysis, right, sir? And aberrant epiphysis, generally they are absent, sometimes they are present. When they are present, then it is known as the aberrant, like the head of the first metacarpal. This is the aberrant epiphysis. Atavistic is ending with the C, so C for coracoid process. So remember, coracoid process is the atavistic epiphysis, which is actually separate bone, but during the evolution now fused with the nearby bone. Are you getting? Okay, now look here. Yes, bone tumor. One question sure from here. So this was our sixth topic. We were counting more than 100 plus topics are from here. So the formula for the bone tumor, demo ECG. Do you remember? The bone tumors are arising from the diaphysis, metaphysis, epiphysis. How can you get? Sir, you will understand this all the concept with the anatomy. Directly and not indirectly, the questions will ask from here. So just one quick revision. D for diaphysis. Diaphysis is giving rise to the Ewing sarcoma. Yes, which is having the onion peel appearance. MCQ. Yes, M for metaphysis, O for osteosarcoma, where you will see the sun rays appearance, Codman triangle. Done. Next, epiphysis. It is giving rise to the chondroblastoma. Getting the point? Okay. And this epiphysis also giving rise to the giant cell tumor, where you will see the soap bubble appearance. लिख के ले लो 6 question 6 question till now na 6 topics. Okay, sir. Now after that, one question sure from the joint. So we did this joint topic very beautifully in detail. So just look here. What are the different types of the joint? Yes, the summary. FCS, the non-veg mnemonic for the joint. FOX, F for fibrous joint, C for cartilaginous, S for synovial joint. Yes, again the fibrous joint is divided into 3 category. Yes, सा सू जी अर्ज किया है. स्टूडेंट की भी क्या लाइफ है? अर्ज किया है कि स्टूडेंट की भी क्या लाइफ है, ना हस्बैंड है ना वाइफ है। ओके, तो इस तरीके से हमने एक बढ़िया सा फनी लाइन बोला था और सासू माँ को याद किया था। एस फॉर सूचर, एस फॉर सिंडेस्मोसिस, जी फॉर गॉम्फोसिस। नाउ कार्टिलेज जॉइंट प्राइमरी एंड सेकेंडरी। नाउ द साइनोवियल जॉइंट, द ब्रांड एम्बेसडर ऑफ द एनाटॉमी मींस सैलमन बॉय, वसुधैव कुटुंबकम, समस्त संसार को अपना परिवार मानो, सभी से प्यार करो, भले शादी मत करो लेकिन प्यार सभी से करो। सो one time, yes, he loved Priyanka Chopra auntie. So the funny limerick for the R, yes, you can say the synovial joint, Priyanka Chopra से बहुत प्यार हुआ. So what are the different types of the synovial joint? Plain synovial joint, condylar synovial joint, saddle synovial joint, ellipsoid, ball and socket, pivot, and the hinge joint. Done. Okay, now after this all, yes, look here, sir, you can see the fibrous joint when the two bones are having the connective tissue with the fibrous tissue. So this is the synorthosis. Cartilage, when there is a cartilage, then there is a cartilage joint partial movement, amphiorthosis. Synovial joint, when there is a synovial fluid free movement, then it is a diorthosis. Done. Okay, fine. Okay, sir, now look here, the sutures. Again, you can remember the suture with this formula: plain suture, squamous suture, serrated suture, dented suture, wedge, and groove suture. Done? Yes, sir. So you can see easily the different types of the sutures. Sir, when the articulated surface is plain, plain suture, articulated surface is oblique, oblique suture, squamous suture, zigzag, then serrated suture, when tooth-like interlocking, dented suture, and when, yes, triangular, it is getting fit into the groove, that is a wedge and groove or shindylisis. Yes, then we had seen the synodesmosis. The two bones are interconnected together with the help of the ligament, then it is syndesmosis. The classical example, FMG 2022 MCQ. Yes, we are covering the each and every PYQs. Answer is the middle radio ulnar joint is the synodesmosis. Yes, but superior and inferior radio ulnar joint, these are classical example of the pivot joint. These are the classical example of the, yes, here you will do the supination pronation movement. Hollywood, Bollywood, Tollywood. Do you remember Amitabh Bachchan uncle? One hand here, another hand here. Yes, Amitabh Bachchan uncle is doing this movement. Okay, Kajrare, tere kare kare naina. So Amitabh Bachchan uncle is dancing in this way. This is the what? This is the diadochokinesia. This question had been asked in your exam. Okay, alternative supination, pronation. This is the diadochokinesia. This diadochokinesia is done. Yes, balancing movement you can do. You can say the supination pronation. This is done at the pivot joint, superior and inferior radio ulnar joint. Another question. Okay, now look here. The cartilage joint, the cartilage is there, but when it is completely getting ossified, so this is the primary cartilaginous. Yes, no movement is possible. This is synchondrosis between the epiphysis and diaphysis. FMG 2025 question. Okay, while the secondary cartilaginous between the two cartilage. Yes, there is the fibrous connective tissue. So it is not getting ossified. Yes, sir. Partial movement is possible. So this is the symphysis joint. Are you getting? This is the symphysis joint, like the pubic symphysis. Okay, sir. And then we had seen the R synovial joint. Okay. So just see the ball and socket. So it is a multi-axial joint. Okay. So it is showing the movement: flexion, extension, abduction, adduction, medial rotation, lateral rotation. The classical example is the shit, SHIT. यहीं से क्वेश्चन आएंगे, ध्यान से सुनो बेटा. Yes, S for shoulder joint, H for hip joint, I for incudostapedial joint, ENT question, NT for talocalcaneonavicular joint. Getting the point? And then I told you the biaxial joint, that is the ellipsoid joint. So just twist this E, it is turning into W and M. So this wrist joint and the metatarso-phalangeal joint. So do you remember the knuckle joint? अर्ज किया है फ्रॉम द साइड ऑफ द डेडपुल अंकल टू द लोगन अंकल. वो क्या घबराएगा किसी मंजर से जो पिछवाड़ा भी खुजलाता हो खंजर से. Getting the point? So this joint of the Logan uncle means metacarpophalangeal joint. Sir, this is nothing. It is the ellipsoid joint, and this wrist joint, flexion, extension, abduction, adduction. Only the bi-axis. That's why this is your, yes, ellipsoid joint. So I told you this all the things. Okay. खोपचे में खुजाया होगा. तुमको कोई प्रॉब्लम, डॉक्टर मॉर्फिन वो कहीं भी खुजलाए, कैसे भी खुजलाए, तुमको क्या करना है? Yes, आगे बढ़ो. So now there is a uniaxial movement. Sir, this is the only one axis, uniaxial. So this is hinge joint. Just like we are opening the door, we are closing the door. So what is happening? We are opening the door and we are inviting the guest. आइए, पधारिए. So in this way you can remember the hinge joint. I for interphalangeal joint, uniaxial. E for elbow joint, uniaxial. A for ankle joint at the foot. These all are the, yes, remember, hinge joint. Done. Now there are the two joints. Yes, they are having the parallel articulating surface, plain synovial joint. And when there is a S shape, So this is the saddle joint. And when you will see round condyle, so this is the condylar joint. Sir, knee joint and the temporomandibular joint, they are classical example of the condylar joint. And when there is one central axis and around it any other bone is showing the rounded articulation, and there is a yes rotatory movement, then it is the pivot joint. Remember, C1 C2 atlantoaxial joint is a pivot joint. Okay, yes, INICET number 2001-25 question I discussed with you. C1, that is the our atlas. Okay, above occipital bone. Yes, so here atlanto-occipital joint, it is ellipsoid joint. Ellipsoid is better answer than the condylar. Here flexion of the neck occurs, so this is what, this is a yes movement. Now below C2, this is the atlantoaxial joint. Sir, here is the pivot joint. Here no movement, rotatory movement, no movement. Are you getting? So fracture of the C1 is known as the Jefferson fracture, radio orthopedic integration, and C2 fracture is known as the hangman fracture. Are you getting the point? Okay, clear everybody? Also, I want to inform you at my Instagram right now, you all are having the very close time. So the very important topics in form of the microanalysis, they are uploaded here now. So stay tuned with my Insta account also. Fine. So here you will get this one, like anesthesia, FMG. So whatever the important topics, you can stay tuned ना. So stay tuned with this. अगर इंस्टा नहीं है तो और अच्छी बात है बेटा, बहुत अच्छी बात है ना. You are getting selection. Fine. Okay. Now look here. बेटा फिक्स होता है ना कि कहाँ से क्वेश्चन आने वाले हैं. जस्ट यू टू रिवाइज देम अगेन एंड अगेन. ओके फाइन. ओके सर, अगर इंस्टा नहीं है तो बहुत अच्छी बात है बेटा, यू ऑल आर गेटिंग सिलेक्शन ना. फाइन. सो नाउ आफ्टर दिस ऑल आई एम गोइंग टू शो यू दिस ऑल द थिंग्स in 3D way. चलो फटाफट आंसर करना है ना. You have to give the answer what are the different types of the joint. Let's start the quick revision. Look here, sir. This is what skull. S for skull, S for suture. So this is what suture? Yes, interpalatine, intermaxillary, they are plain suture. Fibrous, very good. Sir, temporoparatal, squamous suture. Sir, this is what? Bragma, interparatile. Also you can say the frontoparietal suture, serrated suture. And then this is the your what? Occipital area, dented suture. This dented suture is yes lambda suture. Very good answer. Very nice, Dorami, Sachin, you all are right. Now here this is the vomer and the sphenoid bone. Yes, so this is the sphenoid, this is the vomer. So between this shindylisis also you can say wedge and groove suture. Now I'm showing you the synodesmosis. Quick revision. MCQs with the three-dimensional orientation, radius and ulna. So between the radius and ulna, this is middle radioulnar joint. Sir, this is the, yes, you can say synodesmosis. But sir, this superior and inferior radioulnar joint, this is rotatory movement. So this is the, yes, you can say pivot joint. Na? Okay, gomphosis in the gums. Now look here, the few important joint. Sir, this base of the thumb, don't forget, at the first metacarpophalangeal joint, this is the saddle, S shaped. Very good answer. So